Hi, my name is Liam Latre, and I'm doing a speech today on universal healthcare. Universal healthcare will save American money and American lives. It's one of the most important things that we could do to shift and change our country for the better. There was a study done in 2007 that showed that 60% of American personal bankruptcies were caused by medical bills. Now, that is a massive amount of people who are struggling and drowning in debt, trying to just simply save their own lives. We have a problem in this country. This affects everyone, but it most importantly affects the poor, who, when they're hit with these medical bills, cannot recover, and it affects them for the rest of their lives. America spends too much money on medical bills, and the multi-payer system is to blame. If we combine Medicaid and Medicare for All into one universal healthcare system, we could help our country immensely. And I know this personally. I really started researching this after last year when I had a $5,000 concussion, and I have fantastic insurance. I wasn't even in the hospital overnight. I had an IV drip, and my concussion cost me $5,000. This is not an affordable way to go about getting health care, and that's all we have here in America. The U.S., on this graph, as you can see, this is the United States, Germany and France, Canada and Britain. This line here is the medical care received, and this line here is the spending. The United States spends by far the most amount of money, but does not receive the optimal amount of health care. As you can see here, Germany and France receive an optimal amount of health care due to the amount of spending and the care received. We, in the United States, supersede that by 6% of our GDP. We spend 18% of our GDP on medical costs. No other country has ever spent more than 12%. It's illogical, and we need to fix it. The multi-payer system is really who's to blame here. We in this country pay into individual insurers and hope that those insurers will negotiate on our behalf in case of a medical emergency or injury in which we need drugs or therapy, in which they would be provided to pay for that. That's what our insurance system has created. But those single insurance companies do not have the bargaining power to actually keep prices low or keep prices at a consistent place. Our prices in America fluctuate all the time, and most of the time they're fluctuating up, charging Americans astronomical amounts of money. The average hospital bill since 1990 has gone up 600%. 600%. If we combine Medicaid and Medicare and create universal health care, it will be the best step for our country. We need it. We cannot afford to not have government negotiation power on drug prices. We cannot afford to lose things like dual eligibility, because the dual eligibility in this country is costing us $46.8 billion every year that could be avoided if we had a universal healthcare system. $46.8 billion, and that number was provided by the Urban Institute and the Kaiser Commission. In conclusion, we need to switch from the single-payer system that we have now, the multi-payer system we have now, and we need to switch to a universal healthcare system in which we have that ability and we have a fighting chance. Now, there isn't a lot that you or I can individually do to create universal healthcare today or tomorrow, but there are a lot of bills and groups that are trying to move on this in our country. And with the support of the people like me and you, in the future we can change and can hopefully create a system of healthcare that is good, robust, and saves lives without ruining them with medical bills. Thank you.